So you had a knee replacement, and the big question is when or should you go back to work? It's a very important question that all of my patients have that are still working. And in today's video, I'm going to share with you all of the things that I discuss with my patients to help them decide when it is best to return to work. So stay tuned. Hello and welcome back. Adam Rosen here. Thanks for tuning in. If you have not already subscribed, please subscribe and click the like button so people like you can find this channel. And if you haven't already checked out my book, The Knee Book, The Guide to the Aging Knee, if you're having knee pain, if you're thinking about knee replacement, this book tells you everything that I've shared with all of my patients over the past 20 years. In today's video, I'm going to talk about a really important topic that I talk to a lot of my patients about, and that is when can you return to work after your knee replacement surgery? And simple answer is it depends. It depends a lot on your job, and it depends a lot on the person. The simple answer I give to people is 3 months. And then usually the eyes bug out and people say, what? And I say, yes, 3 months. And the 3 months is there for a lot of reasons. First of all, you have to decide also whether or not you have a very desk-related job, sedentary or heavy labor. You know, if you have a more desk sedentary job, 3 months probably is the maximum, and you most likely can go back sooner. If you have a more labor-intensive job, it's possible that it might be 4 months until you're safe to be climbing ladders and working on scaffolding and picking up heavy objects. The reason that I tell patients that you need to take 3 months off of work is because you need to put your health first. You have to rehab and recover from your knee. And if you've watched any of my other videos, especially the ones on range of motion, you'll know that your best chance of getting full range of motion after a knee replacement is in the first 6 weeks. And between week 6 and 12, you have a good chance of getting range of motion. And after 12 weeks, you can regain strength and endurance, but you're not going to get motion back. So if you go back to work prematurely and your therapy suffers because of it, and you get stiff, and now at some point in the future you want to redo therapy, guess what? It's too late. You missed the window. And the other reality is that work's going to go on without you. And I personally realized this as much as I kind of knew it but didn't believe it when I had my issue and my mental health crisis, which took me out of work for a year. That was a big fear for me about, well, what's going to happen to my patients and who's going to take care of them. And you know what? Work went on without me, and people picked up the slack, and it will continue without you in probably 99.9% of the jobs on the planet. But the other reason I try to tell patients that you need time off of work is you're going to be tired. People don't realize how much this surgery takes out of you, the energy that you usually have. So for my older patients that are used to taking a nap, now find that they take 2 or 3 naps. And younger people are surprised that middle of the day, they're just exhausted and they need to lay down and take a nap. And it's probably frowned upon if you're at work. The other thing is that after this surgery, because of pain and some sleepless nights and medication, most patients have a bit of brain fog. So if you have a job that requires you to make important decisions about the business or people or money, you do not want to be making bad decisions because you're not thinking clearly. So that's another reason to kind of put work off. The other thing related to that is pain and medication. So you're going to be taking multiple medications throughout the day, and it can be hard to go to work and keep all of those things in line as to when you take which pill. But also, if you're on narcotics, you probably shouldn't be at work or operating heavy machinery or driving to and from work. So you got to get off those meds and have the pain under good control before you go back to work. Now, you might be thinking, yeah, but I have a job where I sit all day. Worst thing possible. And again, this comes down to the fact that we want you to get good range of motion. So if you can get to work and you sit in your chair and you sit there for 4 or 5 hours and you go to get up, your knee's going to be stiff, it's going to be painful. And you might be thinking, well, I'll come home and do my therapy. And guess what? At that point, you're so tired, you think I'll do it tomorrow. And now your knee suffers and you start to develop scar tissue, which could impact the range of motion in your knee for the rest of your life. So, which is why it's important to do your therapy exercises 3, 4, 5 times a day, and that can be quite hard or difficult at work. Um, Now, it's not to say that you can't work at all. I do have some people that occasionally will log in for a meeting virtually or answer a few emails or take a phone call. Like those little things are okay if your work will allow you to be out of work but still doing some work related activities. But the important thing is taking 3 months off of work. And this is the other reason that if you take off 3 months and you recover well enough and in 6 or 8 weeks are feeling good enough and are cleared by your doctor and your therapist to return to work, I have never had a patient say work didn't want me back. They forced me to stay out the full 3 months. Usually they're welcoming you back with open arms and they're happy to have you back. The other issue that I see patients make the mistake of doing is even though we tell them take off 3 months, they say, no, I'm going to go back to work in 4 weeks. And they go back to work, and that day they're miserable, they're tired, they come home in more pain, they have to call out of work. Now they feel bad, and then work is angry because they had someone covering, and then they let that person go, and then you were back for a day, and now you're out, and then they're trying to fill in your job position with someone else on short notice, and it just throws a monkey wrench in the game. So staying out and coming back early is always easier than planning on going back prematurely and having a problem and have to go in and out, in and out. Now, the honest truth is when you go back to work depends on you. Why? Because you're an adult and you know your job best and you know how you're feeling. And there may be financial issues that require you to go back to work early. But again, put your health first because your health is priceless. What I find is that the patients that do take 3 months off, even if they were good enough to go back, say, at 8 or 10 weeks, those patients come back to see me in the office and they look better. I see patients before surgery, they're dealing with chronic pain, and they look tired, they look drawn, and they come back with a smile on their face, a nice glow. They all tell me they're sleeping better, they're exercising more than they've exercised in years, they're eating better. They overall just feel more energized, healthy, and younger, and they're so happy that they took those 3 months to recover. So if you're going to invest in you, if you're going to invest in your health, if you're going to invest in the time and energy to have a knee replacement, try to put aside the 3 months to recover, not just from your knee, but just recover as a person and develop better nutrition, better sleeping habits, better exercise habits, and you'll walk back in the door at work feeling better about not only your knee, but your health in general. So I really hope this helps answer the question that many patients have about when to return to work and what things they should look out for. And this should hopefully guide you in your recovery. And I wish you the best. Until next time, I'm Adam Rosen. Stay safe.